Hello, Assalamualaikum. We are group Stomach Ulcer. These are our team member. Atira Nabiha, Ana Widian, Nurul Ain Atikah, Nurin Nisrina and Zurin.
Assalamualaikum and hi everyone. In this slide, we are going to explain and let you guys know about what stomach ulcer is. So let me start by briefly explain about what is stomach ulcer. What is stomach ulcer? Stomach ulcer also can be known as a gastric ulcer. It is sore or lesion that form in the lining of the stomach. Other than that, ulcer can also be developed in the upper part of our small intestine, which is we call it as duodenum and will be referred as duodenal ulcer.
Stomach ulcer develops when the protective layer in stomach, which is mucosa lining, damaged. The mucosa secrete mucus. It plays a role to neutralize acid in the stomach. And the mucus plays the role as well as the innermost layer of stomach in good condition. The mucosa lining can be damaged for a reason such as infection of Helicobacter pylori bacteria. This bacteria may come from people's saliva when we communicate with them or from the food we eat. It will attach on the protective layer and cause chronic inflammation. So the mucosa lining damage and lose its ability to protect our stomach from stomach acid. Do you know that stress and spicy food can increase the production of stomach acid, but the bacteria can survive in acidic environment while our mucosa lining cannot. Other than that, the overuse of non-steroidal anti-inflammatory drugs also can lead to damage the protective layer. For example, people with cardiovascular problem consume aspirin to release their pain, and the non-steroidal anti-inflammatory drugs can stimulate the secretion of gastric acid and produce prostaglandin. So, the mucous barrier become weak. This condition can increase the risk of mucosal injury and from a stomach ulcer.
So who always get affected by stomach ulcer?
Okay, now I will continue with the part which is who always affected with the stomach ulcer. Stomach ulcer usually happen to the person that really love to skip their breakfast every day. That's really not good for our health. It is because when we skip our breakfast, the time when the gastric juice come into our stomach, if we doesn't have food in our stomach, it will affect our stomach area and cause ulcer to our stomach. That's the main reason why stomach ulcer happen. Okay, second, it's usually affected to the person that doesn't have pattern of eating. Normal pattern of eating in someone daily life is we eat time breakfast, lunch and dinner. But to the person that doesn't have pattern of eating, they will eat just when they hungry. That's not good for our stomach. Okay, lastly, it usually happen to the person that don't go check up when they realize the symptom that happen in their stomach. We should prevent it before it become worse.
Hey, how to prevent from getting stomach ulcer?
Hi, my name is Nusina. Let's continue with my part, which is how to prevent stomach ulcer. Certain lifestyle choices and habits can reduce your risk of developing stomach ulcer. These include not drinking more than 2 alcoholic beverages a day, not mixing alcohol with medication, washing your hands frequently to avoid infection, limiting your use of ibuprofen, aspirin and naproxen, maintaining a healthy lifestyle by quitting smoking, cigarette and other tobacco use, and eating a balanced diet rich in fruit, vegetable, whole grain will help you prevent developing of a stomach ulcer.
So what are the symptoms to get stomach ulcer?
Next, I will briefly explain about the symptoms in stomach ulcer. For an example, the most common symptoms of peptic ulcer is abdominal pain, which is this pain may be dull or burning and it may come and go over time. And many people that have peptic ulcer or stomach ulcer don't have any symptoms until the ulcer leads to complications.
Okay, the second symptom that happen if someone has stomach ulcer is weight loss. The weight loss doesn't happen because of diet, exercise or lifetime change, but it happen because of the ulcer in their stomach, which is the ulcer make them eating painfully, which is the patient of ulcer stomach will avoid eating milk so that their stomach doesn't feel painful. This will affect their eating pattern and how the body can absorb the vitamin and nutrient.
Hello, my name is Ain Atika. So, in conclusion, it has been eventually established that peptic ulcer is becoming a common disease across the globe, which can affect quite a lot of people, especially cigarette smokers and alcohol consumers. As a precaution, when a gastric ulcer is suspected, ensure that this patient obtain the best care. They need to receive education about gastric ulcer at all levels. Owing to our modern advancement in technology and medical research, the diagnosis, treatment, and prevention of peptic ulcer has been made easier and more reliable. Ulcer can heal if they are given a rest from the factors that create them. Healthcare providers treat accomplished ulcer with a combination of medicine to reduce stomach acids, coats, and product the ulcer during healing and kill any bacterial infection that may be involved. Medicine may include such as calcium proton pump inhibitors, histamine receptors, blockers, and antacids. The counter medicine help to neutralize stomach acid. They may bring some symptom relief, but they aren't enough to heal your ulcer. They also might interfere with some antibiotics. But remember, they need to hear it from their healthcare providers, nursing staff, medical assistant, and pharmacists the most. Gastric ulcer has healed, they need to avoid the non-causes of ulcer and use medication to prevent them. That's all from me.